to another episode of Conversations with G&G. And today we're diving into a critical topic, preventing falls from a podiatrist's perspective. And joining us is an expert in the field, Tom from Geelong Mobile Podiatry. Tom completed his Bachelor of Applied Science in Podiatry in 2009 at Queensland University of Technology, and he then went on to Master of Public Health in 2014 from the University of Queensland. And with a wealth of experience working in both hospitals and private practices right across Queensland and also Victoria, Tom brings a deep understanding of foot health, biomechanics, and also sports injuries. And beyond all of his clinical work, Tom has also contributed to the field through published research with a particular focus on diabetic foot care and also wound management. Today, he'll be sharing his insights on how proper foot care and podiatry assessments can play a vital role in fall prevention, particularly for adults and those at risk. So whether you're concerned about a loved one or maybe you're simply wanting to stay informed, this episode is packed with valuable information. So let's step into the world of podiatry and learn how to keep our feet and, of course, our balance in top shape. Welcome, Tom.
Thanks, Danny.
Hey, welcome, Tom. That's an exciting episode for sure. Very relevant topic.
Yeah, it's a kind introduction. So falls have a major impact across our lifespan, but especially for older adults. They're the leading cause of hospitalisation and serious injury. And it has a particular impact on older people because of changes that happen as we get older. So reduction in muscle strength and coordination, leading to increased risk of falls, and then chronic conditions that we get. So things like diabetes can affect our nerves in our feet and our balance, strokes, different medical conditions also increase our risk of falls. Our vision can decrease, so that can increase our risk of falls. Cognitive issues can increase our risk of falls. So all those things combined together on top of reduced bone mass means that if we do fall, we're at a higher risk of fractures. And so a hip fracture, as we all know, can have a major impact and can lead to sort of end of life. But falls affect younger people, kids playing soccer, they can fall and fracture themselves. Falls in the workplace, they're probably where the major for general adults. But yeah, for older people, falls, just a simple fall from a ground height can have a really significant impact.
And it's quite common, isn't it?
Yeah.
Common.
Yeah.
So it's definitely a good topic to cover today, I think.
Yeah.
So I'm so curious, what should I do then from my age to make sure my foot are nice, healthy and strong?
Yeah, so the best thing that you can do is staying active and healthy. From sort of 30 to 40, middle age, we start to lose our muscle strength and our bone mass can also reduce. And this can have a particular impact on women as well. So going through menopause, you get a more rapid rate of muscle and bone loss, so more likely to get osteoporosis. And it's weaker bones that are going to lead to those major impacts of having a fall, so fractures. So from throughout your lifespan, staying active and healthy is going to be the most important thing that you can do. As you're getting older, if you're feeling like you are at risk of falls or you're finding it harder to get around, a big sign that you're at risk of falls is having difficulty getting out of a chair. So if you need to use your hands or something like that to get you out of the chair, that's a sign that you're going to be, at a bigger risk of having a fall. So if you're noticing things like that, talking to your GP about possible programs that are available in the area, seeing an exercise physiologist or a physiotherapist to help with strength and balance training. That's been shown to structured strength and balance programs are going to reduce falls, people at risk by up to 30%. So definitely really worthwhile. And then, if you have any issues with your eyes, getting your eyes checked, taking care of your health. Medications can also be an issue, so having your medications reviewed by your GP or a pharmacist. And then looking after your environment, so if there's things in the way that could cause a trip hazard, so removing mats or having them fastened to the ground, making sure that cords aren't in your house, trying to make sure that you're not getting on ladders or, not getting sort of above ground level. Yeah.
Well, this risk assessment is very important to have that in place.
Yeah. So particularly if you're frail, so talking to GP, they can do a risk assessment or so having a health professional do a risk assessment.
Back to the exercise that you mentioned before, I'm interested if there is any particular exercise or sport that helps with strengthen, and improve your balance, because I'm also aware that there are some sports, maybe for example, that actually can be even more at risk of having injuries. And as you age, what are those activities specifically? If you can give us some tips on that, I'm very curious personally.
Yeah, so sports like soccer, tennis, where you are, right? You're going to be at high risk of having a fall. So if you're, if you are frail, probably potentially avoiding those or doing them in a safe way. But structured strength programs can be very safe, and they're going to improve your muscle mass and your bone strength. Tai Chi is also really good. That's been shown to improve your balance and reduce your risk of falls. So
you want to be purposeful in the exercise that you want to do, as opposed to just stay active and do any sports.
Yeah, so staying active and healthy is going to be great, but in terms of specific falls prevention, maintaining your muscle and bone mass. So a structured strength program. And that can be done throughout your life. Even if you don't think that you're going to be lifting bigger weights, but done in the right way, you can do a strength program safely. So talking to your GP, potentially seeing an exercise physiologist, that can be very beneficial. And
very good. Yeah. Interesting. Yeah,
that is very interesting. Yeah.
I'll start checking it out now.
Yeah. You're pretty good, I think, generally.
Yeah.
So how do falls impact the overall health and quality of life of an elderly or senior person?
Yeah, so having a fall, having a hip fracture, for example, that's going to have a long rehabilitation process. And if you do have one fracture, you're sort of 4 times more likely to have another fracture. So if you have a fracture, you're much more likely to have another one, unfortunately. You can imagine going through that rehabilitation process, the time off your feet, you're going to lose more muscle, lose more confidence. So making sure that you do have a program to get you back to where you were after you have a fracture is really important. Another thing that can happen is feeling like you're at risk of falling or having a small fall, but you might not have a major injury, can give you a fear of falling and then reduce your confidence in going out and about and sort of a downward spiral in terms of increasing your risk. So addressing your fear of falling is really important, and that's important too when you're doing a falls assessment to see if the person is fearful of falling and trying to address that.
Or there's a natural problem with their feet.
Yes.
Like sometimes it might look like it's out of fear, but there's actual problems in their feet.
So
I'm talking about my mom's example, right? It was, my father, for example, was saying, she's very fearful, she lost confidence, but the reality is there was a problem.
So people with foot pain are much more likely to fall as well. So addressing those issues is really important too.
And it is important for social connection, because if they're not going out because they're scared,
that's right,
then they're not speaking to people or seeing people, they're not part of the community and so forth. So it extends out to that as well.
That's right. So getting mobility aids, making sure that you're doing things safely, but not reducing your activities or going out and about your social things. So
very good.
So Tom, what are some of those changes or I guess foot conditions that can happen? Like obviously there's things like sunken arches and maybe arthritis of the feet, things like that. Do you see that a lot?
Yeah, so as we get older, our feet, like our whole body, change a lot. And that starts with the skin. So the outside of the skin loses its resilience, and the outer and inner layer of the skin that join together, that joining reduces, and you're more likely to get blisters and problems like that. And the turnover of skin reduces as well. You're more likely to get things like corns and callus, which are hard. Callus is a relatively normal thing to get, but as we get older, it can get really thick and become painful. And corns are like a callus that goes into the skin and can feel like a little rock under the foot. So that can be quite painful as well. And And in terms of the foot, we're more likely to get arthritis, reduced joint range of motion, reduced strength in the feet, so that reduces our balance and coordination. We get deformities like bunions and hammer toes. And so all of these things we know increase our risk of falling. So managing those is really important to reduce the risk of falling.
There's a lot to look forward to, eh?
Oh, yeah. Can't wait. Might book our appointments in with you now.
Well, I was really shocked, even just, I reckon, sort of the 40, 42 mark. I'm nearly 47 now. Just the changes, I guess, that happen physiological, especially Giselle, like for women, the changes we go through with kids and, just all those stages. But like, even at my young age of 46, I have arthritis in my feet. I have, those things sort of, I've actually got it all through my body, but it's just, you don't expect to get it so young. And I didn't even realise that was the problem. And so I think, when we're talking falls prevention, so important, like you just said before, Tom, to, if you feel pain, go and get it checked out. Like, because you don't know what it is, address it early. And don't let it become a problem, because the more you can keep active, the better, really.
And so shoes are another sort of important factor there as well. One from comfortable, well-fitting shoe, because the shoe can cause pain, especially as we're getting older. If we're getting claw toes, which is where the toes come back, they can become quite high and they can rub on the shoe, or bunions, where the toe comes in and sort of pops out at the first toe, that can rub on the shoe as well. So making sure that your shoes are comfortable and not rubbing and causing issues there. And then also making sure that your shoes are right. So wearing things like slippers that don't attach at the heel, they can increase your risk of falling, so you've got to kind of work to hold that slipper onto your foot, so that can be a trip hazard in and of itself.
Is this part of your service?
So Crocs are
assessment?
So if we come and we're definitely going to be looking at your footwear.
Holistically.
So looking at your footwear, looking if you have foot deformity, looking, is there rubbing that's happening, and then trying to gently talk about that with the client. So, if you've had a certain pair of shoes for a long time, you might think that's the right shoe for you, or if you have foot pain, if you're in your 80s, you might have had foot pain since you're 60. You've had it for 20 years. It just is a normal part of your life, and it can be sometimes a bit hard talking to clients around things that they might be able to change to help them. And then other people are very keen as well, just to get the right shoes for them. But shoes, they're very important for our feet to reduce our pain, but they're also an aesthetic thing. We generally choose shoes as part of the way that we look, not thinking about the health of our feet.
See, I find that interesting. It like crosses over to the whole fashion industry, like no thongs, no Crocs. It just goes beyond that, doesn't it? It's like, it's actually not good for you, but it doesn't look good on you either. So just don't go there. You could almost have like a fashion hit list and then just put the podiatry stuff in there with,
Well, a lot of there's some podiatrists that have launched their own footwear brands, haven't they?
Yeah.
There's quite a few of them.
My granddad tried to do that too. He tried to change from sandals with socks. It's like, and at Christmas dinner, he turned up in a suit with, and I'm just like, no, please no.
Put a stop to it.
I think they were orthopaedic, but that's not going to count.
Yeah. And I'm guessing grip-on shoes is probably a big one too for falls prevention.
Grip, So in terms of the shoe, the things that you're looking for is obviously not too high of a heel.
To stilettos around.
Having a bit of a bevel and a relatively good grip is important. But in terms of the grip, if you're in a slippery surface, the shoes just aren't going to grip. So if it's wet or unstable, then it's not going to make much of a difference. So having a relatively good grip, but just also not having a high heel. It's also really important to have the shoes that will hold your foot. So you need either laces or Velcro. Velcro can be good as we get older. It can be harder to reach down and do our laces. And that is a big difficulty for some older people in terms of just getting down to your feet can be hard. So a number of people will just want to have a shoe that they can just slide their foot into, but that's then not holding onto their foot. So finding a way that they can put the shoe on and have it secured safely to their foot so it's not a trip hazard in and of itself.
What about things like maybe synthetic versus leather or breathability, are they important as well to consider with certain conditions?
Yeah, so they'll be important for your overall foot health. Leather can stretch a bit versus a synthetic, but when you're looking for your shoes, you don't want to put on a shoe and have it feel tight or think, oh, this will stretch out. You want it to feel comfortable at the start. So things that you can do to find a shoe that's going to fit right is, one, getting it professionally fitted, but two, going at the end of the day when your feet are probably a bit swollen, because that's when you want the shoe to be able to fit properly. You don't want your feet to swell and then you get rubs and blisters and things like that.
That's a good idea. I didn't think about that.
I didn't think about that either. Very good tip.
I wear Geox, and the shoes are prescribed.
Yeah.
What's the word?
What did you say you wear?
Prescribe?
Perspire. Perspire. That's the word.
Yep.
So it's got
His favourite
invisible holes underneath.
Oh, Geox. I thought he
So
said
water
Jocks.
doesn't come in,
We're Jocks.
but the air
Oh, great. Yep.
comes out.
Yep.
And I feel that amazing because it's just very comfortable. And it doesn't sweat your feet. You know.
Yeah.
Yeah.
Yeah. Geox.
Geox.
Yeah, you
Geox.
should check it out.
Yeah.
I've got them here.
We're all going to have a look.
A foot examination now.
Nice.
So shoes important. Are there any other prevention strategies?
So
We talked
shoes-
about exercise
So
too.
shoes are really important. And coming down to the foot, it's addressing those age-related changes that cause foot pain. So finding the right shoe that accommodates any foot deformities, that has the right grip, not too of a high heel. Or if you do have foot deformity, getting medical grade footwear can sometimes be good. So extra depth in the shoe, or a stretchable upper, or extra widths. And then having an insole in the shoe can be really important too if you're getting foot pain. So the cushioning in the heel and the forefoot reduces as well as we get older. So we get higher pressures under the foot. Combined with our skin not changing over and not being as resilient, we're more likely to get these corns and calluses, which further increases pressures under the foot, which often cause pain. So supporting the foot with an accommodative insole and then some extra cushioning under those areas that are getting sore makes a big difference to reducing pain, makes us more comfortable when we're walking. So a shoe with a supportive, accommodative insole, and then addressing our skin care and nail care. So if we have claw toes, the nails can tap on the ground and that can cause pain if they're not properly managed. And then if we do have corns and calluses, having them removed sort of generally on a regular basis, because they tend to come back every sort of 6 to 8 weeks, and as they develop they can cause pain under the foot. So managing it from that perspective, and putting some moisturiser into the feet every day is generally a good thing as well. Feet tend to get drier as we get older.
Fantastic. So much information.
I know. So much to think about.
Yeah.
Considered.
I actually saw something on Instagram, I think it was the other day, and I know it's a reliable source and all, but it was talking about children's feet and like the shape of shoes, that they should be broader and not too narrow. And of course, in women's fashion, and you see even older ladies still wearing heels, wanting pointy toes, that kind of thing. Is that something to consider too? Like
Definitely.
the shape of the top of the shoe? As in...
Definitely, throughout your life. So
not sort of squashing your toes together.
When you're
and
younger,
stuff.
being barefoot, getting around is great for your feet. You want to have plenty of room in your shoes. You want to have at least sort of a centimetre from the end of your toe to the end of the shoe. So looking at those sorts of things for your children, making sure the sides of the shoe aren't rubbing. And then you're right, as we get older, you'll have a look at the foot, and it's sort of the shape of the shoe, and it's that triangle kind of shape. So giving your feet plenty of room, and that's especially important as we are getting older, because something that rubs and causes a blister, if we don't have the same blood supply or we have diabetes, a small blister can turn into a major problem as well. So we definitely don't want our shoes to be rubbing or causing injuries to us.
Yeah. We had a high school principal for one of my kids. She was nearing retirement and couldn't wear anything but high heels because her Achilles had shrunk. It literally had changed the whole structure of her foot.
Wow.
Because she wore them every day for years.
Goodness gracious.
And so I can imagine in that kind of a situation too, that must be
that
bit
is something
tricky
to be careful of.
with
If
falls.
you're telling somebody to not be in a
Yeah.
high heel, if they don't have that ankle range of motion, that they can't actually be in a lower style shoe. But but just having you can still have a bit of a heel in the shoe, but having a flat sole rather than a sort of pointy heel is going to improve the grip of the shoe.
Because then there's things too, I guess, like people who have like one leg longer than the other, and you know, they need insoles and things like that.
Build-ups in the shoes.
Yeah, wow. So much to think about.
I know, big range.
Our feet are so important, right?
That's right.
Healthy feet. It's like balance, strength, mobility, you know, fall prevention, you know, it's all in there.
Yeah.
So it's so critical.
Yeah.
And you see many people coming to you preventative, you know, sort of approach, as opposed to I've got a problem and I need to come and see you. Like, do you recommend preventative visits?
Definitely. So if you have any concerns with your feet, getting them checked is worthwhile. And then as we age, the foot problems become more and more likely. And then by the time we're sort of 65, 1 in 3 people is going to have some sort of a foot problem.
So if you know if 1 in 3 is going to have an issue, might as well get it checked up.
That's right.
Before it becomes an issue.
Yes. Yeah.
It's a bit like going to the dentist. Go to the dentist every 6 months for a checkup. Do the same with your feet. So go ahead.
I mean, it makes sense, I think, isn't it?
Yeah, that's right. Yeah.
To just make sure you're on the right track and, you know, looking after your feet.
Yeah.
Absolutely.
That's definitely what we would recommend.
So what are some of the other ways that the foot can change as we get older?
So, like I said, the common ways, or what happens to everyone, is that we get these skin changes that have a fairly big impact on, 1, more likely to get wounds, but 2, more likely to get corns and callus, which can cause pain. Bunions are very common, and claw toes are very common. And so if you have a bunion or a claw toe, you're more likely to have a fall. Same if you have reduced strength in your feet. So that's you're more likely to have falls as well.
Yeah. I think we better start getting our feet checked out, guys. So do you have shoe brands that you would recommend? Like, if I came to see you, you checked out my feet and you're like, you need A, B, C, D, like, where would you...
Definitely. And it would start with what your goals are and the activities that you do.
Yep.
You know, if it's a work shoe, running shoe, hiking shoe, that would be sort of form the recommendations. But shoes, running shoes in particular, hiking shoes, they're all really good. So it's a little bit like cars. So, you know, within the brand, they've got to have a good shoe, and then it'll be just guiding you to the right shoe for your foot type and the activities that you're doing. So in Geelong, there are lots of really good shoe shops that can help you with that, and we'll give you specific advice based on your feet and the problems that you might be having.
Yeah, because some shoe shops, they get you to run on the treadmill and they film it, don't they, to see how your foot's moving, and then they can make recommendations. So something you guys would do too? Yes,
except with the shoe shops, they're going to be looking at just, you know, the way that your foot is rolling in or rolling out. Whereas if you're coming to see a podiatrist, it's going to be more around any conditions that you're having. So if you're having pain in a certain spot, then there'll be a footwear recommendation to help with that.
Yeah.
And there might be an insole or some exercises that would go along with that too.
Yeah, okay.
And high level speaking, what someone can expect from an assessment from a podiatrist? What are the things that you go through, generally speaking?
It's going to be, a good conversation about who you are, why you've come in, what the problems that you're having, and then having a look at your walking, have a look at the bones in your feet, the way that they move, and then going on from there to specific treatments and treatment options. So it might just be exercises, it might be treatment of the actual problem, so if it's an ingrown toenail or something like that, fixing that up, or there might be insoles as well and footwear advice. So it's going to depend on what you're presenting with.
Can I ask a question about toenails? What's the best way to cut them? Straight across? Or you follow
Good
around?
question.
I know, I've always wondered.
Should you file them?
I don't
Is nail
Well,
polish
we
bad?
can find out.
What colour would you recommend? No.
So cutting toenails straight across is what's recommended, or just not coming too far back in on the sides. So if you go too far back, it's going to increase your risk of an ingrown toenail.
Yeah, okay.
But just following the general curvature of the nail without going too far across. And filing is a really good.
Yeah. And so should you leave a little bit of the white tip at the end, like once it's finished?
Yeah.
Like not past the nail bed
Everyone's
too
nails
much?
are going to be different, and the way that our nails curve into the skin is different as well. And as we get older, our nails do tend to curve more and thicken more as well, which can increase our risk of ingrown toenails. But yeah, so just following the natural curve of the nail and not going too far back on the corners.
Yeah.
Okay.
So from a broad perspective, to reduce risk of falls is staying active and healthy, managing your medical conditions well. If you've got any issues with your eyes, having that checked, getting the right shoes, and seeing a podiatrist if you are experiencing any foot pain or foot problems.
Yeah. Sounds good. Some good tips.
Fantastic.
Amazing.
Absolutely. Well, thank you so much, Tom. Yeah,
Thank you.
Great.
Thank
Great to have
you. Yeah, absolutely.